The client should be familiarized with the ergometer. If using a cycle ergometer, properly position the client on the ergometer, i.e. upright posture, 25-degree bend in the knee at the maximal leg extension, and hands in the proper position on the handlebars. Obtain resting heart rate and blood pressure immediately prior to the exercise in the exercise's posture. The exercise test should begin with a 2 to 3 minute warm-up to acquaint the client with the cycle ergometer and prepare him or her for the exercise's intensity in the first stage of the test. A specific protocol should consist of 2 or 3 minute stages with appropriate increments in work rate. Heart rate should be monitored at least 2 times during each stage, near the end of the second and third minutes of each stage. If heart rate is greater than 110 beats per minute, steady heart rate, i.e. 2 heart rates within 5 beats of each other, should be reached before the workload is increased. Blood pressure should also be monitored in the last minute of each stage and repeated in the event of hypotensive or hypertensive response.
RPE and additional rating scales should be monitored near the end of the last minute of each stage. Client's appearance and symptoms should be monitored and recorded regularly. The test should be terminated when the subject reaches 70% heart rate reserve, fails to conform to the exercise test protocol, experiences adverse signs or symptoms, requests to stop, or experiences an emergency situation. An appropriate cool-down and recovery period should be initiated consisting of either a continued exercise at a work rate equivalent to that of the first stage of the exercise test protocol or lower, or a passive cool-down if the subject experiences signs of discomfort or an emergency situation occurs.
All physiological observations, for example, heart rate, blood pressure, signs and symptoms, should be continued for at least 5 minutes of recovery session until abnormal responses occur, which would warrant a longer post-test surveillance period. Continue low-level exercise until heart rate and blood pressure stabilize, but not necessarily until they have reached pre-exercise levels.